here speaking on the nutritional considerations in Pompeii. I hope everybody is doing well and staying safe where they are. Am I able to move forward?
Yes, you are.
I'm not able to advance my slides.
Hold
Have
on
you
one
given
second.
me control?
Yep, just 1 second.
Okay.
How about now?
No?
Okay, I will do them for you then.
Okay.
If I'm lagging, just please say next slide.
Okay. Next slide. Okay. Next slide. Okay. So these are the objectives of my presentation today. We are going to be talking about why do nutritional therapy in Pompeii? What are the guidelines for nutritional therapy in Pompeii from infancy to adulthood? And see the role of exercise along with nutrition in modifying the disease course in Pompeii. Next slide. So we know that Pompeii disease is a disease where there's progressive loss of muscle mass and strength. So just like any therapeutic intervention for Pompeii aims at preserving this muscle mass and improving the functioning and the quality of life of individuals with Pompeii. And nutrition therapy is no different. So the aim is to optimize muscle health, strength, and functioning in children as well as adults. But in children, we particularly want to make sure that children are growing well and staying healthy, and that we are establishing healthy eating behaviors in them, and then helping them meet the recommended dietary allowances for all nutrients. And in adults, it's important to maintain a healthy BMI as well as meet all the recommended dietary allowances. Research on diet therapy in Pompeii, actually way in the 1970s, there was research done on mice that showed that modifying the diet of mice helped in improving the muscle mass and their activity level. But the first study was published in 1983 by Dr. Slonim in New York. That was done on a 7-year-old child that showed that after 12 months of high protein diet, there was improvement in the muscle function. Then about 14 years later, Dr. Bodamer, he published a series of a compilation of basically case reports of 16 subjects that showed that only about 25% showed improvement in the muscle and respiratory function on high protein diet. Then in 2006, Dr. Ravaglia showed that in 8 patients over 3 years, high protein diet, it stabilized the muscle disease progression, but it did not really improve clinical symptoms. Then in 2007, Dr. Slonim again published a report on 34 patients where he used nutrition therapy along with exercise, which he called NET, for over 2 to 10 years. And patients consumed a high protein, low carbohydrate diet with L-alanine supplementation and did aerobic exercise. And he showed that with compliance, there was actually slow deterioration of muscle function, and there was improvement in the natural history of adult onset Pompe disease. So this was in 2007. And enzyme replacement therapy for Pompe became available in 2006, and that took a priority. And many other, the other modifying interventions kind of did not get as much attention. But over the last few years, we have seen that enzyme replacement therapy, while it really improves pulmonary function, it doesn't help much, and the cardiac function, it doesn't help as much in the skeletal function, plus the effectiveness can stabilize or even diminish after a while. So the role of diet is and exercise is getting more and more importance again. It's important to know the rationale for diet therapy in Pompeii. Why do we think diet works? And to understand that, it's really important to know what the pathophysiology of muscle damage in Pompeii is. We know that in Pompe disease, there is excess accumulation of glycogen in lysosomes. And these lysosomes, they are very important organelles within the cell because that's where a lot of other functions happen. And two of those important functions is mTOR, which is mechanistic target of rapamycin. These are signaling pathways within the lysosomes. And this pathway, it signals the availability of various molecules or even nutrients and stimulates the cell to synthesize protein. At the same time, it also stimulates autophagy. Autophagy is like a recycling mechanism within the cell that helps in recycling unwanted material for the cell, or sometimes even nutrients like glycogen. And research from the NIH has shown that in Pompeii, autophagy is affected. Lysosomes are so burdened with glycogen that they are not able to perform autophagy well. So this is the rationale. By eating a low carbohydrate diet, you are going to reduce the glycogen accumulation in lysosomes so that autophagy is not as severely affected. And you're going to eat a high protein diet can stimulate protein synthesis by providing those amino acids and by encouraging the mTOR signaling. And then it can also reduce proteins breakdown, which is called proteolysis, and muscle damage. So this is the rationale for the diet therapy in Pompeii. Next slide, please. So I want to state or get this across is that a diet for Pompe disease should include all food groups. There's really no need to avoid any major food group. We need starches and vegetables and fruits and meats and dairy and fats. So all these foods are allowed in a Pompe diet. Next slide, please. Talking about protein, we know these are the sources of protein: meat, fish, eggs, nuts, butter, seeds, dairy products. These are all good sources of protein because they have a high biological value. Protein from animal sources have a high biological value, which means that their composition includes all the essential amino acids, which the body cannot make. And an ounce of each of these proteins provides the same amount of protein. An ounce provides 7 grams of protein, or a cup of milk provides 8 grams of protein, or an ounce of nut provides 5 grams of protein. So it doesn't matter whether you eat chicken or lamb or beef or fish, an ounce provides 7 grams of protein. Next slide, please. Carbohydrates are important because they provide a source of energy. They provide satiety in the diet. They provide important nutrients, including fiber. But it's important to know the amount and the choice of carbohydrates. Amount is important because excess intake of carbohydrates can lead to glycogen buildup in the body, and that's why you want to limit your carbohydrates. Choice is important because complex versus simple carbohydrates. You want to choose carbohydrates that have a low glycemic index. Low glycemic index foods are the ones where there is not as much increase in the blood glucose levels, and the insulin response is low. So carbohydrates that are high in fiber, like whole grains, legumes, or vegetables that have fiber, they have a low glycemic index. And these are just examples of simple versus complex carbohydrates, or high versus low glycemic index foods. You want to limit the foods on the left, or actually try and eliminate those and eat limited or some amounts of the complex carbohydrates in your diet if you have Pompe disease. Next slide, please. Role of fats. Fats are a good source of energy. A gram of fat gives 9 calories. They give satiety in the diet. It's important to choose healthy fats. Fats which are high in poly and monounsaturated fatty acids are good because they are source of important fats like DHA and EPA, which are important for the nerves, the brain, the eyes. And they also, oils such as flaxseed oil, walnuts, olive oil, peanuts, those are all important sources of linoleic acid and alpha-linolenic acid, which are precursors for making DHA and EPA. And just like everybody else, it's important to limit saturated fat. Next slide, please. So this is a Pompe diet, a good amount of protein, lots of vegetables, high fiber, complex carbohydrates for the starch. And this diet is high in protein, so it should be implemented under experienced medical professionals like the dietitian and physician. Next slide. I want to talk about nutrition in infants with Pompe disease. Children with infantile onset Pompe, they often have insufficient nutritional intake and failure to thrive because they have facial hypotonia. Sometimes they have a large tongue or tongue weakness. They have oral motor weakness, and that can affect their ability to suck and swallow. It can cause saliva pooling, drooling. There's risk of aspiration. Just the cardiac insufficiency or cardiac hypertrophy can cause breathing difficulties, and that can cause increased exertion. Difficulty in respiration causes difficulty in feeding, and there's risk of aspiration and lung infections. And there is potentially increased calorie expenditure. So because of all that, nutrition, getting enough nutrition can be a challenge in infants with Pompe disease. Next slide. And the feeding issues can present soon after birth, or it can present a little bit later as the dietary intake and textures are advanced. Oral intake can fluctuate over time. Feeding ability in the first 6 months can predict the long-term feeding ability. Enzyme replacement therapy and speech and feeding therapy can help a great deal. Enzyme replacement therapy itself can improve the facial muscle strength and tone and improve the oral feeding ability. Tube feeding is common. As much as 50% of the children or young children, infants I see are on tube feedings. But eventually all can be expected to have a little bit of oral feeding ability. Next slide. So I often get this question about in newly diagnosed infants with Pompe, is breast milk okay? Or should my child be on infant formula because it has higher protein? Breast milk as well as infant formulas, both are appropriate to meet the nutritional requirements in the first 6 months of life. Although breast milk is lower in protein and iron, it is highly bioavailable. So the infant can really absorb it better and make good use of it. It has superior fatty acid composition plus the immunological components, easily digestible, and it's cheaper, of course. So when I see an infant with Pompe disease actually able to nurse on the mom, or even be able to take breast milk expressed through a bottle, I feel very delighted. I feel excited, and I really see, please go ahead and continue that. Infant formula is also okay because the newer formulas mimic so much of the good properties of breast milk. There are formulas that are made from that do not have any sugar, and you can also manipulate the calorie density and the protein content. And formulas are convenient also, although they sometimes can be expensive. So the choice is yours. Both can be okay. It's important to know that protein intake in children should be calculated based on body weight rather than percentage calories, because this is a question I often get from young parents. Should my child be eating more protein, or my little baby being given more protein. I really discourage that because children have very high calorie needs, and as they grow, as they take in more formula and advance to solid food, there's really a natural tendency to increase protein intake. And there's really limited evidence to show the benefit of increasing protein intake in infants with Pompe. Plus, there are also the issues of harmful effects on kidney and endocrine function if you give way excessive protein for infants. Next slide. So this is an example about how children automatically just increase their protein intake from birth till they are about toddler age. Breast milk is lower in protein. It has only about 0.3 grams of protein per ounce. And a breastfed child gets about 5 to 6% energy from protein. Formula-fed children get about 10%. But then by the time they are 1 year old, when you transition them to 1 year to cow's milk has 3 times the protein than breast milk and twice the amount of protein than formulas. So by 1 year of age, even if a child is drinking maybe like 2 cups of whole milk and having, or skim milk, no child, baby should have skim milk, but even a 2% fat milk, the protein is the same. The child is going to increase in his protein intake very significantly. And then as you add solid foods like meats, even an ounce of it, like you saw, an ounce can be present like in a small meatball. That can add another 7 grams of protein. So it's very easy to reach that goal of 2.5 to 3 grams of protein per kilo in children without making much effort. So there's really a natural tendency to exceed the protein above the RDA as the child grows in a child who eats meats. Next slide, please. So this is the diet of children with Pompe, really a balanced diet that encourages healthy eating habits. You really don't need to do anything except remove, discourage junk food and sugar. Next slide, please. And for those toddlers who really don't care for protein, these are some fun ways that you can add protein in their diet. Next slide. And these are some ideas for school-going children who have very busy and, sometimes peer pressure and all, and, they don't eat or forget to eat protein. This is a good way to add protein in their diet. Next slide. More than the protein, I think parents should really worry about controlling the carbs in young children because taste is acquired early. It's important to introduce vegetables and meats before starchy and sweet foods. Avoid fruit juice. The American Academy of Pediatrics recommends not more than 4 ounces of fruit juice for children up to the age of 5. If you give fruit juice, limit it to 4 ounces and then dilute it with water. Avoid the candy, cookie, chips, French fries, wrap. Be prepared on outings, including infusion tips. Pack your own snacks. Encourage vegetables, and it's okay to use non-nutritive sweeteners in small amounts rather than sugar. Next slide, please. These are the recommendations for adults with Pompe. I basically recommend about 1/3 of calories coming from protein, carbohydrates, and fat. In adults, it's important to base the protein need on percentage of calories rather than body weight because adults weigh a lot. If you base it on body weight, you end up eating a lot of protein, which is not good. And then this slide talks about the kind of protein we talked about, kind of fat and carbohydrates, and how to choose. Next slide, please. So we want to do a high protein diet. So you want to figure out what is a high protein diet. So here is an example about how you work through it. You want to have about 25 to 30% calories coming from protein. And for that, you need to know your calorie allowance. So generally adult males, men who are not active, need about 1800 to 2000 calories. Women need about 1600 to 1800. You want to do about 25-30% of these calories from protein. So 25% of 2000 is 500 calories. 25% of 1600 is 400 calories. Okay, now we have the calories that need to come from protein, but how does it translate into how many grams of protein? Okay, a gram of protein gives 4 calories. So you divide 500 by 4 and you go to 125 grams of protein for men And for women, it's about 100 grams of protein. So this is just the general guideline or recommendation. So now we know how much protein we need, but then how much of the food do we need to consume to meet our protein requirement? You don't generally need to get a scale and actually weigh the protein. It's good to just have this habit of visualizing. And we know that an ounce of protein gives 7 grams. An ounce of chicken, fish, meat gives 7 grams of protein. So just know that a 3-ounce portion looks like a deck of cards or the palm of your hand or the mouse of the computer. So that's a 3-ounce portion, and there you are, 21 grams of protein. If you double it, you have more than 40 grams of protein right there in a meal. And a cup of milk is 8 grams of protein. So this is an easy way to track your protein intake. Next slide, please. These are some practical tips about how to meet protein. Distribute that between your meals and snacks so you stay on track. Include protein at every meal. Double up on the portion size. Instead of eating regular yogurt, eat Greek yogurt. Eat whole eggs. Using protein supplements is not a bad idea. A lot of my Pompe patients use that. There are really some really low calorie, low carb, sugar-free protein supplements out there. Next slide, please. Weight issues are common in Pompe. We see low body weight quite frequently because of muscle wastage. Just the cachexia that we see in chronic diseases is seen. And we want to avoid that because weight loss means muscle wastage most of the time. And that affects your functioning and your quality of life. So it's important to gain that weight. Instead of eating 3 big meals, eat 5 to 6 small meals. Make them power-packed. Sip on protein drinks throughout the day. Don't eat sugary foods because they fill you up. And get some regular exercise because exercise stimulates appetite. And just like underweight, we do see excessive body weight in Pompe sometimes. And that's again many times because of diet and many times it's because of inactivity. Even if you have to lose weight, avoid fasting because fasting results in muscle breakdown and lean body wastage. Cut the carbs, the sugar. Eat foods of high glycemic index. Eat a lot of vegetables, green, yellow, orange, red, make it colorful. Drink a lot of water. And monitor what you eat. There are a lot of programs out there that help you to track your calories and protein. And again, get regular exercise. Next slide, please. So we are going from nutrition to exercise, and I do want to present this one study that just came out recently in the last couple of months that stresses exercise and nutrition go together. And this study, which was done very systematically in 13 individuals with late onset Pompe disease, showed the benefit of exercise and how that benefit can really be very significant if it's combined with a high protein, low carb diet. So these researchers evaluated 13 patients on 2 different individualized exercise and diet modalities, 26 weeks of just diet and then 13 weeks of washout and 26 weeks of diet and exercise, high protein diet. And these patients continued on 20 milligrams of enzyme replacement every 2 weeks. So the goal was to really evaluate the benefit of this on exercise tolerance, muscle and pulmonary functions, and compliance and quality of life. Next slide. Exercise training was 4 sessions a week, included warm-up, stretching, strength training, aerobic. Diet was personalized. They used registered dietitians to really figure out each person's diet. Calories were 25 to 30% coming from protein, carbs, and fat, 35 to 40%. And the protein was well distributed throughout the day. Next slide, please. 13 patients, 19 to 71 years of age. Age at diagnosis, 3 to 67 years, 3 to 10 years of enzyme replacement. Walton scale score showed that some of them were able to function completely on their own independently, and some needed some assistive devices. Some were, BMI was 17.5 to 28.4, some were underweight, some were overweight. And nobody really needed any invasive ventilator support. This is the diet composition before and after. You can see that the first one is fat, and before, fat composition was anywhere from 30 to 40, whereas during the intervention it was mostly 35 to 40. Carbohydrate was 50 to almost like 30 to 60%, and then during the intervention it was reduced nicely. Over here you can see to about 35%. Fiber was increased. Protein, you can see significant increase from maybe 10 to 15% to nice 30% increase in protein. Next slide. Okay, this is a very important slide. These are all the different things that they studied. But what I want to really show is that these are the control people, individuals who did not do any exercise or diet. These are the individuals, the same individuals when they did just the exercise, 13 weeks of exercise, and then 26 weeks of exercise, and then after 13 weeks of washout, exercise plus diet. And you can see that BMI stayed the same in the controls, reduced in exercise, but with diet and exercise, there was, when it shows two arrows, it shows that it's a significant decrease or increase. So you can see that the BMI was significantly decreased when there was exercise and diet component. These are all the, please go back one slide, yeah. These are all the parameters that measure pulmonary function, like aerobic capacity. And you can see that individuals who did not do any exercise and diet and just did ERT, there's really a decline in the pulmonary function. But with exercise, there's increase in the VO2 max and significant increase in VO2 max. This is like the maximal aerobic capacity a person can develop. Muscle strength did not, and then there was also improve in forced expiratory volume, how much your body lungs can expire oxygen or air. Not much difference in the strength, but a significant reduction in the enzymes CK and LDH, and these are the enzymes that show protein breakdown. And you can see that with a high protein diet combined with exercise, there's reduction in these enzymes. And very important is that there's really improvement in the quality of mental health as well as quality of life. And there was good adherence to these dietary and exercise protocols. Next slide, please. I just have two slides now. One is the importance of that what we see, osteoporosis is seen commonly. So it's important to make sure you have enough calcium, vitamin D in your diet. And there are good supplements available. Osteoporosis can be because of just loss of muscle mass or poor nutrition or lack of exercise. And GI issues are significant, now getting more and more recognized, because now it's known that glycogen deposits not just happen in the skeletal muscles, but also in the muscles of the GI tract or the smooth muscles. And that can affect the contraction or of the GI muscles, as well as the nerves of the GI muscles. So it's important to have a high fiber diet. Fluids are important. And now we have more and more patients reporting to us that they're benefiting from a Fodmap diet or a SIBO diet. Fodmap is like the fermentable oligosaccharides. So the diet has to be really individualized. You have to figure out what works for you and what doesn't. These are difficult diets, but if it helps you, you need to, you can discuss with your dietitian. Next slide, please. Okay, so here we are. It's important to eat healthy. It's important to have an individualized diet that will meet your nutritional needs and feeding abilities. And high protein and low carb diet is beneficial, especially when it is individual combined with the exercise program. Thank you so much.
Wonderful, Surekha. Thank you so much. That was a lot of really good information, and I loved how you kind of broke it down and shared for both early and late. That was fantastic. Please remember, if you have any questions for Surekha around nutritional considerations in Pompeii, please feel free to chat those into the Q&A box. I did have one question, and it's very topical because I think we do get asked this. Do you have recommendations for folks who maybe aren't sure how to find a nutritionist if they don't have one immediately in their center where they go? Do you have a recommendation as to where someone could find a nutritionist?
I think the best source would be your primary care physician. Most GI clinics do have nutritionists, but then there are also private practicing nutritionists in all states. You can also go to the Academy of Nutrition, and they have a customers, like you can call them and ask what are the names of some private practicing nutritionists in the state. That would be the best way to go.
All right, thank you. We did have one comment come in while you were talking. It says, many people are not aware of the moringa tree. The leaves provide many of the nutrients that we need, including proteins. Are you familiar with that?
Yes, moringa is a leaf, and it is considered to be it has wider application. People are using it for many different conditions. I think, to me, for protein, you will really need to consume a lot of moringa. We have to remember that it's, after all, a vegetarian source, and so it could be classified as a vegetable, and vegetable usually has maybe 4 grams of protein per cup. So you're going to have to eat a lot of moringa. Plus, I must say, honestly, I have not looked at the amino acid composition of moringa. Like I said, when you want protein, try to get protein that has a high biological value. So I don't know if there are any clinical studies done on the availability of moringa for protein utilization or the synthesis. So yeah.
Okay. Perfect. Thank you. I think that was the only other, here is yeah, the person who mentioned that just said, from what I understand, the protein value is high.
Okay.
So
I'll look into that. Yeah. Thanks.
Wonderful.
I mean, there are vegetarian sources, like you can eat quinoa. Quinoa is a very high protein grain, and as far as I know, it's the only grain that has a complete amino acid makeup, just like animal proteins. So that would be a really good alternate vegetarian protein.
Right. Wonderful. Well, Surekha, thank you so much for joining us today. Oh, it looks like we actually did get one more question. I want to try and cover as many as I can. What fruit would you suggest is the best for Pompe patients in regards to sugar? My daughter loves fruit, so trying to pick the best one.
Okay. I, in my practice, do not discriminate between fruits. I do place like 1 to 2 fruits a day is good. As just don't do fruit juice. And if you are looking at the glycemic index, then yes, I think berries are better rather than maybe, mango or orange or watermelon. But any fruit is okay as long as you limit the quantity. It's like half cup, 2 servings a day is not going to hurt. You do not need to eliminate fruit from your diet. Remember that one slide I showed where the Pompe diet should include all food groups.
Yeah. And I think to that point, someone else had asked, should I cut sugar completely out of my diet?
I can tell you it's not going to hurt you. But, occasionally a piece of cookie or something is okay, but just don't have a sweet tooth. And again, it's not what you eat, it's how much you eat. So a small cookie once in a while, it's okay. You don't need to completely remove, but sugar is really shown to be the culprit for a lot of chronic conditions now because of the insulin response it generates. So lower sugar, the better.
Wonderful. All right, Surekha, well, thank you so much. We greatly appreciate this information. I think it was very helpful for the audience. Thank you for joining us.
Thanks for the opportunity to present. Bye.